Welcome back to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
And we welcome you back to Talk of the Town for this Friday, September the 4th. I'm Gary Stevens. We will have open line following the 11 o'clock news, but we are joined on this first Friday of the month in our 10:30 segment by Mike Goorhouse. He is the president of the Community Foundation of the Holland, Zeeland Area, joining us via Zoom connection. Mike, good morning and welcome back to WHTC.
Good morning, Gary. Thanks for having me.
Glad you are with us. And if you have a question for Mike about what's going on with the Community Foundation, he'll be happy to answer it at 395-1450, 395-1450. Many of our discussions over the last few months, Mike, have been pretty much focused on the community's response to COVID-19, how the foundation is helping organizations and individuals get through the matter. All hands on deck, emergency situation, and rightly so, we need to focus on that. But the Community Foundation also does things on a regular basis that might be getting a little bit overlooked. And I think today what we're going to do is to take a step back away from the COVID-19 to a certain extent. A little bit will still be focused on that. But we'll talk about some of the Community Stabilization Fund grants that have been issued by the Community Foundation to help people not only in this COVID-19 situation, but also to help organizations that normally serve the community during even the best of times.
Absolutely. Yeah, it's the Emergency Human Needs Fund is what we called kind of that first real emergency response. And then we pivoted in June to this Community Stabilization Fund, which is a partnership between the Community Foundation and other donor families to really kind of try to set the stage for the recovery. We called the Stabilization Fund because we didn't feel like we were quite to that recovery stage yet. But the reality is that there's a lot of work to be done coming out of the kind of free fall to stabilize the community, stabilize families, stabilize individuals, and then hopefully prepare for a meaningful recovery to come. So that's the focus of this Stabilization Fund. And we really identified three key areas we were going to focus on. One was financial stability. And we really kind of break that up into basic needs, but also preventing people from slipping into poverty. One of the things we know is that there are times in people's lives, a lot of people have perspectives on those that are in poverty, but for many, it is a moment in time. Something happens and the spiral begins. And if we can stop it at the top of that spiral before someone loses their home or before they lose their job or before they spend all of their savings or whatever it may be, it's easier and hopefully a more effective way of keeping people out of poverty. So we're focused there. We're also focused on education and mental health. So those are the key things, and happy to launch into a few of the grants that we've made, Gary, if that's what you'd like me to do here.
I'd like to do that, but I want to change the order a little bit.
Yeah.
And I don't know whether or not she'll have her ears up or not, but Peg mentioned it. There was a proclamation made by Governor Whitmer earlier today, sort of getting everybody ready for next week with suicide prevention.
Yes. This is Suicide Prevention Awareness Month. It's also Military Suicide Prevention Awareness Month, and she's designated next week as Suicide Prevention Awareness Week.
And the reason why I had Brett come in and do that is that one of the grants in the Stabilization Fund is going to the Holland Free Health Clinic, indeed dealing with mental health, and that's right up the alley there.
Yeah, absolutely. So we just distributed $135,000 in grants, with a majority around kind of mental health and substance abuse, with a majority of those focused on mental health. So the Holland Free Health Clinic $30,000 award was to increase the hours they had for some of their staff members, particularly focused on mental health needs. Same thing for City on a Hill Ministries Health Clinic. They had some resources available to help folks with counseling. But a $30,000 award to help them increase their availability to respond. And then a few others as well. The Boys and Girls Club, with our young people, they have a social worker, but it was one social worker serving both clubs, actually all three sites that they have. And so we gave them a $15,000 award to add some staff capacity on that front. And then some traditional mental health counsel places with Mosaic Counseling as well as Beacon of Hope. But to the point that the governor has made for this next week, there's a report out of Pine Rest that gives some pretty staggering statistics and predictions of what mental health looks like in our community right now, but also going forward. They pull on previous pandemics in other parts of the world, and the number of people that are in very anxious situations and are at a place that are at a low point for their mental health is unbelievable. And it's people that haven't always had a lot of experience with navigating this. So we have many, many seniors who kind of grew up in an era where the idea of mental health and taking care of your mental health wasn't something that you really talked about or did, or the resources weren't even there. And they're for the first time navigating, what does it look like, this anxiousness that I'm feeling kind of deep in my soul? How can I go get help? How do I get help? And you have many people, loss of jobs, that just shakes you, right? You know, for each of us, that idea of not having the ability to provide financially for yourself or your family really cuts at your core. And how do we ensure that the resources are there so that people know how to access counseling exactly when they need it, right? So the Suicide Prevention Awareness Week and Month, one of the keys is making sure that when people feel it deeply, that they have a place to call, and that when they call, there's someone to pick up the phone, and there's a place for them, someone to talk to, and they can respond right then. What you can't have happen with mental health responses, you can't say, we're taking appointments for October, we'll put you on for October 6th. You can't do that. That's not the way you respond to mental health crises. And so we need this awareness for anybody out there who may not have had experience with how to wrestle with this, for they know where to call, and there needs to be someone on the other end of the line that can respond and help that individual in that moment, anytime, any day. Otherwise, I am fearful for what's going to happen in the coming months to come.
Mike Goorhouse, you and I are speaking the same language in that regard. That is one of the biggest concerns I had when this COVID-19 situation came about, and we were told, stay home, stay safe, social distancing. I say it's social isolation because of that particular problem. We are social people. We need to be with others. And yes, there's nice to make call a 211 or calling a crisis hotline in that situation. But to me, it's not the same as having somebody come alongside you, arm around the shoulder. Hey, I'm with you. And even our virtual chat right now, it's nice, but it's still, at the end of the day, I can click end and I'm still by myself. And that's not good.
No, and that's exactly right. And the number of people, if people really pause, there's close to, the latest statistic I think I've seen was there's close to 20% of the population in Ottawa County are single adults. And that could be a variety of ages. And so these are folks that are primarily been isolated. You use that word, Gary. And as you said, that's not the way humans are meant to be. And so what I would encourage everyone listening is, first off, the anxiousness, mental health struggles, depression, it's real. So if you're feeling it, you do not need to feel like you should hide that or that you should be embarrassed by that. And it does not mean that it happens every moment, every day, right? This anxiousness can kind of come and go. It's hard to know when it gets triggered or not. But I would encourage everyone, there are resources out there to help. And so please do seek out those resources. And then for those that know loved ones, if you sense that your loved one may be in an anxious situation or stressful situation, please do not wait. Too often, suicides come before people think it is a very serious issue. And so please do not wait. If you have a sense, please do engage with the individual, help support them, and help connect them to resources. And that's part of what the foundation is funneling resources for. We don't have enough by ourselves. I'm certainly hopeful that the state and the federal government will continue to consider putting additional resources in, because that is, you know, you talk about stabilization, that free for all, you're just trying to respond, but mental health is a bit of a lagging one, right? It takes a little bit longer sometimes to show up, and the longer you're isolated, the worse it gets. And so we need to be focused on providing those resources. In my opinion, any amount of resources, if we're saving lives, is worth it in my mind.
By the way, Mike is outside today, and we don't mind the ambiance. It's,
Thank you.
It's definitely, that's fine. We don't need to have, it's not. It's a beautiful day, and Mike Goorhouse is enjoying the beautiful day. That's one of the problems about being in our studios. We really can't take our show outside a little bit. But anyway, it is a beautiful day out there, and we're talking some good things with Mike Goorhouse. If you want to have a question with the president of the Community Foundation of the Holland Zeeland area, you'll be happy to answer it at 395-1450, 395-1450. I know I'm sort of maybe steered our conversation towards mental health, and of course, obviously, with the governor's declaration, the timing of it was pretty good. But I do want to talk about one of those $30,000 gifts, grants, and it goes to OAR to increase outpatient clinic capacity. And that's a very important thing. Tell us about what OAR does and how this grant's going to help them out.
Yeah, so OAR is one of the primary providers of substance abuse counseling in our community. A lot of the referrals go there, but as well as community members find their place there. And what they have found is that they historically provide both outpatient and inpatient services, but with COVID and a lot of the restrictions, the inpatient has been a less desirable option for many people. So we are providing resources to help them increase their outpatient capacity to serve folks via digital, but also other kinds of focus groups that are also outpatient. And this is really, again, the statistics are not great. When you think about isolation and you think about anxious times, drug and alcohol abuse tends to go up. And we're experiencing similar types of things in our community. So we know that drug and alcohol abuse by themselves is something that is very, very worthy of tackling. But we also know that when drug and alcohol abuse goes up, it leads to other non-healthy behaviors as well. And so trying to ensure that people have access to those resources is important. So OAR is probably, it's a key important organization in our community that we don't always talk about a lot, but for those that have experienced their services, they know it well because they do their job very, very well, and as a community to support them right now is very, very important.
We have spotlighted today in our conversation with Mike 6 organizations getting a total of $135,000 in Community Stabilization Fund grants focusing on mental health and substance abuse services. Let me just run down the list of the grantees. And we touched a little bit upon some of the grants and some of the purposes for that. $30,000 grants awarded to OAR to increase outpatient clinic capacity, to the Holland Free Health Clinic to increase mental health, alcohol, and drug counseling, and City on Hill Ministries in Zeeland, the health clinic there, to increase behavioral health integration capacity. $15,000 grants have been granted to 3 organizations: Mosaic Counseling for School Outreach Programming, the Boys and Girls Club of Greater Holland to increase social work capacity, and Beacon of Hope to increase intake capacity and virtual counseling training. And again, Mike, our conversations today and to a certain extent our earlier conversations really focused on dealing with the outbreak of COVID-19 and its consequences and its aftermath, not only directly with the disease, but also the aftermath about stay home, stay safe, safer at home. We're staying safe from the disease, but it comes at a little bit of cost. And what the Community Foundation, Mike, is doing probably is trying to offset some of those costs in that regard.
Yeah, absolutely. And doing that in the mental health way, but also, frankly, the other angle that we've come at this is in the education front. So we know on the education side of things that what was done in the spring and then the creative ways the school districts are responding this fall is what needs to get done from the public health perspective. But it brings along its challenges for young people in their education. And we also know that kids are developing. You don't get to redo age 5 or age 6 or age 7 when it comes to brain development. And so we also provide a significant number of resources and will continue to help close that opportunity gap. We know that some young people are impacted more by this change in closing of in education and at home versus in-person scenarios. And so how do we come alongside those students and their families to provide supports to them, whether that's through the schools or whether it's through community organizations like Ready for School or CASA Upward Bound program? How do we ensure that for those that are going to be most potentially impacted by this change in education structure, that we provide add-on supports. And so we did. We've given over $100,000 so far to respond to the education side of things, $40,000 to Outdoor Discovery Center to help schools maximize their outdoor learning experiences so that we can keep more kids in person. And they're working with many of our local districts. $40,000 to Ready for School to expand their Start School Ready, which was really a summer entering kindergarten program that they're going to expand throughout the whole kindergarten year so they can provide additional supports for students, particularly low-income students of color who have different kinds of access challenges to the education formats that we're providing today. Also, $25,000 to CASA, Children's After School Achievement, which is a program run out of Hope College that supports elementary age kids in their academic success. And they've got some interesting stories in the spring of how they just would do anything and everything to reach the students that they serve, to make sure that they get to take those tests, that they get access to those learning opportunities, that they hit their marks. And we were really impressed with how they just let nothing get in their way. So $25,000 to them to help them continue to serve the elementary school kids that they were serving. And then $15,000 to Family Hope Foundation. Family Hope Foundation provides resources to individuals with developmental disabilities, and many of them, this format is not helpful for their educational journeys as well. And so they've had a scholarship program to provide different kinds of supports and systems for these young people over the years, and we gave it $15,000 to help them serve even more young people, really trying to focus on, again, the youth in our community that are most impacted by this change in education structure. We don't have enough dollars to fill all the holes and gaps, but if we target our resources to those that are going to be most impacted by this change, we can hopefully mitigate some of those losses and keep those students on track, because it's an important time to step in and do that. So education is another one of those places that kind of you alluded to, Gary, when you said that for the sake of the public health crisis, you make choices, but it has consequences in other areas. And so how do we try to come around and get creative and innovative to mitigate some of those other impacts? And education is certainly one of them.
One final thing, Mike Goorhouse, how can people get involved with the Community Foundation of the Holland Zeeland area? How they can help out the Community Foundation? Because let's put it this way, money doesn't grow on the backyard of one Mike Goorhouse's trees.
No, very true. So our website's a good place to engage. It's www.cfhz.org, as in Community Foundation Holland Zeeland.org. And this Community Stabilization Fund, it's had hundreds and hundreds of donors that have given to it. We pool these resources and make these kinds of distributions. So if what you heard today is something that you say, hey, those are the kinds of things I'd like to support, then a gift to the Stabilization Fund will allow us to do more. We've distributed over $500,000 from the Community Stabilization Fund. We've got about another $450,000 to distribute in the coming months. But if we get more resources, we'll continue to support more people. So a donation to the Stabilization Fund is certainly one way that folks can partner with us.
We will put a link to the Community Foundation of the Holland Zeeland area, CFHZ.org. I always like to use that because sometimes people might think it's actual C, it's a C, when actually it's a it's a Z. So CFHZ.org, and we'll put a link to that when we put the podcast of our conversation with Mike Goorhouse on our website at WHTC.com in a few moments. Mike, we'll button up our conversation a little bit early because we're getting close to, unfortunately, the time for us to go bye-bye, but we appreciate you spending some time with us this morning, telling us what the many fine things that the Community Foundation is doing. I look forward to chatting with you, if not next month, about one of your staffers next month, and see what the Community Foundation is up to. Thank you for joining us today, Mike.
Great. Thank you very much.
That is Mike Goorhouse of the Community Foundation of the Holland Zeeland area.